Welcome to Prioritization of Care, a digital assignment by Healthcare Learning Innovations. It's commonly understood that setting care priorities can be a difficult skill for a newly qualified nurse to acquire, and a deficit in this area can have serious consequences for patients. The assignment, Prioritization of Care, represents a solution in the form of a concept-specific digital activity perfect for use in nursing courses or healthcare training programs. This digital assignment uniquely engages students and uses gaming mechanics to do it. While establishing a foundation for prioritizing care, the activity helps to prepare for or enhance clinical practice. Meanwhile, performance assessment is provided to both the instructor and student through immediate feedback, rewards, and the recognition of skill achievement. Prioritization of care includes 5 different settings, 3 levels of difficulty, and a non-linear progression option. After completing level 1, the learner can choose between level 2A or 2B. This gives the learner the opportunity to choose, which can be a powerful engagement strategy when we're providing instruction. Each level, when clicked, provides a brief description of the level, including the level status, number of patients, and difficulty. Locked levels will still allow the learner to preview, which triggers a sense of curiosity and anticipation, therefore impacting the desire to progress further. The first part of each level requires the learner to categorize patients into 2 levels of care by sending them to appropriate departments. The learner will record vital signs and question responses to determine the right level of care for the patient. They need to be sure to include any reflections they might have along the way so that they can be reminded of them later after they've seen the other patients. As mentioned, we will also review 5 predetermined questions. The responses from the patient will contain most of the content for the learner's patient notes to be used later in the activity. SBAR is a commonly known acronym used for handoff reports in nursing. This model helps to communicate situation, background, assessment, and any recommendations to the next shift. We are using this to provide some structure around how the learner records findings, but doing it in a familiar way. Once the learner reflects on the information collected, they must select the appropriate department to send the patient to for treatment. Once a selection has been made, they must enter in their rationale for sending them to this location. After making a department selection, learners are then validated for their response and provided with the correct rationale. There are 9 categories of patients within this digital assignment. If a learner gets 50% of a category correct, they receive a badge. If a learner achieves 100% of the category, they are awarded an upgraded badge. Next, these patients need to be prioritized in the order in which they should be seen based on the information collected. Arrow icons allow the patients to be moved to the 3 different priority slots. Rationale is provided for each priority slot. For example, why is this patient prioritized lower than that patient? And why are they prioritized higher than the other patient? After the priority order is submitted, a final debriefing is displayed providing the correct rationale for the priority slots. Then the learner continues to the other department. After returning to the main menu, the learner will notice that both level 2 options are now unlocked. The student or instructor will now be able to download the report for their level 1 activity. Thanks for